Let's take a month of worry more about the health of our breasts than about their sizes. Breast cancer is a growing concern in today's society. After skin cancer, breast cancer is the most common cancer diagnosed in women. Breast cancer is a cancer that develops in the breast cells, typically the ducts or the lobules of the breast. It can also occur in the fatty tissue and the fibrous connective tissues within our breast.
The symptoms of the most common breast cancers include a breast lump or tissue thickening that feels different than the surrounding tissues and has developed recently. Breast pain, red bitter skin over your entire breast, swelling in all or part of your breast, a nipple discharge other than breast milk, bloody discharge from your nipple, peeling, scaling or flaking of skin on your breast or nipple, a sudden unexplained change in the shape or size of your breast, a lump or swelling under your arm, inverted nipples, changes to the appearance of the skin on your breast. There are several types of breast cancers. They are ductal carcinoma in situ, lobular carcinoma in situ, invasive ductal carcinoma, invasive lobular carcinoma, Paget disease of the nipple, Phyllodes tumor, and angiosarcoma.
To perform breast self-examination, there are two parts to it. Part 1 look and part 2 feel. First, begin with visual examination. You go in front of the mirror and dress yourself. Raise your both arms and look at yourself. Then place your both arms on your waist, turn to one side, turn to the another, and let your breast hang. By doing so, we are looking for three things. First one, the retraction of the nipples. Second one, the dimpling on your breast. And finally, the third one, the masses bulging. Continue by using your hands to physically examine your breast. First, start by touching your neck. Here we are looking for lymph nodes. Then feel the upper part of your chest. Then continue behind your arm, the axillary area, and finally the breast. You can also look for the nipple and the areolar area as well. Be thorough and examine the entire breast. Continue the examination by lying down with your arms raised behind your head. Then feel the back of your arm, the axilla, and finally the breast in circular motion to low to medium pressure. Examine both sides. What we are looking for during this examination are: first one, the masses bulging out; the second one, the dimples in our breast; and finally the third one, any irregularity. If you find any abnormality regarding your breast, you can always consult a doctor. Always remember that you can mark the area where you find the pain, lumps, or any abnormality for easy diagnosis. Now let us continue with the explanation of this exam.
This is the examination area. Invert the position of the arm to examine the other side.
Examination. The first one is pressing from outside towards the inside. The second one is tracing vertical zigzag movements. And the third one is tracing circular spiral movements.
Raise your arms above your head and inspect both the breast, looking for any abnormality, such as liquid seeping from the nipples, folds, dimples, scaly skin, and protuberances.
This is standing position. Now press your hands firmly against your hips and lean slightly towards the mirror while pressing your shoulders and elbows forward. These two movements will make any change in the shape of the breast stand out.
In standing position, examine your right breast with the fingertip of the left hand, pressing softly with circular motion clockwise from inside to outside to feel the lumps or painful spots.
In standing position, examine your armpit with your fingertip, tracing circularly, detecting any lumps or soft area or thickening or bulging under the skin.
In standing position, examine your nipple without changing the position. Press it softly and see if there is any secretion or bleeding. Repeat this process and the previous ones by changing or inverting the position of your arm.
This is the lying position. To examine your right breast, lie down and place a pillow or rolled up turbans under your right shoulder. Then place your right hand behind your head with elbow raised.
Print of your left hand, press softly, tracing circular movements once.
The person should be in the lying position and with the palms continue circling around the breast. Feel the whole surface, searching for lumps and soft or depressed areas. Pay particular attention to the area between the armpit and the breast, as well as armpit itself.
Lying position. To examine the left breast, repeat the previous steps, inverting the position of your arm.
Take advantage of your time in the shower to check your breast and armpits. Soapy water makes it easier to find lumps and other anomalies.
We draw your attention towards 5 early signs of breast cancer that you should notice. The first one, a new mole. Mole is usually linked to breast cancer, but not always the case. Studies show women having more mole had higher risk of getting breast cancer. If you notice a new mole or your mole start bleeding or itching, seek professional help. Secondly, persistent cough, sore throat, dry cough or shortness of breath it indicates cancer cell has spread to your lungs. This is known as secondary breast cancer. This time, have a check. And third one, digestive problem. Some of the main symptoms of breast cancer include constipation, bladder incontinence, loss of appetite, abdomen or pelvic pain. This indicates that something is happening in your body. Fourth one, fatigueness, the most common sign of cancer. When this is due to cancer, taking rest do no good. Studies show 9 out of 10 breast cancer patients experience fatigueness. And lastly, it's back pain. Apart from arthritis, bad posture, prolonged sitting, it is also an indicator of breast cancer spreading to spine. We will say it one more time. Early detection is the key to surviving. The sooner you get diagnosed, the sooner you start with treatment. Thank you for watching. Have a good care.